Hello and welcome to my presentation. My name is EricFloro, and I'll be comparing and contrasting muscles of the upper limbs versus those of the lower limbs. I worked along with Aaron Crislois, Scott DeJong, Jasmine McCarl, and Maggie Thompson to make this presentation. I'll first be comparing muscles of the pectoral girdle with muscles of the pelvic girdle, then muscles of the arm versus those of the thigh, and finally muscles articulating the wrist versus muscles articulating the ankle. Muscles work by applying a tensile force at a distance from a joint, causing torque and thus rotation. We'll be looking at the similarities and differences between the muscles composing the upper and lower limbs. Most notably, we'll be looking at size, position, and function of these muscles. So to start with the pectoral girdle versus the pelvic girdle. The pectoral girdle generally exhibits smaller and shorter muscles than those of the pelvic girdle. For instance, we see this with the generally small rotator cuff in the upper body versus the largest muscle in the body, the glutes, on the lower body. The pectoral girdle also only consists of two components, the anterior and posterior, where the pelvic consists of anterior, posterior, and medial. The pelvic girdle is also known to be more firmly attached to the skeleton than that of the pectoral girdle. This allows for more reaching and range of motion in the upper body, where the lower body supports the body weight and allows for locomotion. This gets into our first question: why might injuries to the shoulder muscles be more common than injuries to the hip muscles? Continuing on with the pelvic versus pectoral girdle, we see that flexion is caused by the pectoralis major in the upper body and the iliopsis in the lower body. Both muscles insert along long bones of the body, but the iliopsis is a longer muscle composed of two muscles that merge together and insert into the femur. Extension in the pectoral girdle is caused by latissimus dorsi versus the glutes in the lower body. Now to compare the muscles of the upper arm with those of the thigh. Once again, we see that the size of the muscles in the lower body are much larger and typically stronger. Also, similar to the pectoral and pelvic girdle, the upper body muscles only consist of two compartments, anterior and posterior, where the lower body consists of anterior, posterior, and medial compartments. The upper arm muscles are used for flexion, extension, and supination of the forearm. The muscles of the thigh are used similarly for flexion, extension, and slight rotation of the lower leg. Muscles of the upper arm and thigh can be grouped based on their function. The triceps and acromius muscles extend the forearm, where the four heads of the quadricep, the rectus formis, vastus lateralis, and vastus medialis, and vastus intermedius, are used to extend the leg and flex the thigh. Contrarily, the brachialis, brachioradialis, and biceps flex the forearm, with the latter two also assisting in supination and pronation movements of the forearm, where the hamstrings, or leg biceps, which include the bicep formis, semimembranous, and semitendinous, extend the thigh, flexing and rotating the leg. Now to compare muscles that articulate the ankle with muscles that can articulate the wrist. The anterior compartment of the wrist consists of the carpi radialis, flexor carpi ulnaris, and flexor carpi ulnaris, which flex the wrist, metaphalangeal joint, and the interphalangeal joints of the fingers. They have a common origin on the medial epicondyle of the humerus via a common flexor tendon. The flexor carpi radialis extends diagonally across the anterior surface of the forearm. It flexes the wrist and abducts the hand. The flexor carpi ulnaris is positioned to both flex the wrist and abduct the hand at the wrist. The anterior compartment, considering the ankle, the anterior compartment consists of the tibialis, extensor hallucinus longus, and the extensor digitorum longus. Similar to how many muscles of the wrist originate someplace on the ulna, humerus, and radius, the origin of muscles on the ankle are typically on the tibia, fibula, or femur. The anterior tibialis muscles originates in two places, being the lateral surface of the tibia and the interosseous membrane, which is fibrous tissue that is found only on the forearm and leg of the body. The tibialis anterior inserts on the plantar and medial aspects of the base of the first metatarsal and functions to dorsiflex and invert the ankle. The extensor hallucis longus originates on the middle of the fibula as well as the intercostal membrane and inserts on the distal phalanx of the great toe. The extensor hallucis longus functions to dorsiflex the ankle and extend the great toe. The extensor digitorum longus originates on the lateral condyle of the tibia, the interosseous membrane, and the fibula. This muscle inserts in a different manner than the others, as it separates into 4 tendons that attach to the dorsal surface of the middle and distal phalanges. This insertion allows the muscle to perform toe extensions. Now considering the posterior muscles of the ankle and wrist. In the posterior compartment of the wrist, we have the extensor carpi radialis longus, brevis, and the extensor carpi ulnaris muscles, which extend the wrist, the MP joints, and the IP joints. They have a common origin on the lateral epicondyle of the humerus. The extensor carpi radialis longus is a long tapered muscle that extends the wrist and adducts the hand. The extensor carpi radialis brevis works synergistically with the extensor carpi radialis longus. The extensor carpi ulnaris inserts on the 5th metacarpal bone, where it acts to extend the wrist and adduct the hand. Conversely, the posterior compartment of the ankle consists of 6 muscles that are divided into superficial and deep posterior groups. The superficial posterior group is composed of 3 muscles, the gastrocnemius, soleus, and plantaris. The gastrocnemius originates from the head of the medial and lateral femoral condyle. The soleus originates from the posterior of the tibia and fibula, and plantaris muscles originates from the lateral supracondyle line of the femur. Collectively, all of these muscles insert at the calcaneal tendon, which is more commonly known as the Achilles tendon. In comparison to the posterior muscles of the wrist and perform extension, each of the superficial posterior ankle muscles allow plantar flexion to occur. The other 3 posterior muscles of the ankle are the posterior tibialis, the flexor digitorum longus, and the flexor hallucis, which make up the deep posterior group. The posterior tibialis originates from the posterior of the tibia and fibula and inserts on most of the metatarsals and tarsals. The flexor digitorum longus originates on the posterior of the tibia, similar to the extensor digitorum longus. Separates into 4 tendons that inserts on the base of each phalangeal apart from the great toe. The flexor hallucis originates on the posterior of the fibula and inserts on the great toe. Altogether, these muscles aid in movements such as dorsiflexion, inversion, toe flexion, and toe flexion, which again differs from the function of the posterior wrist muscles. Which gets into our second question: why is it advantageous to have multiple muscles controlling our wrist movement? That is the end of our presentation. I hope you've seen the similarities and differences between muscles that articulate the upper and lower limbs. We find that by relating structure and function of these 2 groups, we can understand the organizational differences between them. The lower body deals with greater amount of loading because it has to support the upper body, and that's one of the reasons why it is so much larger and stronger. It also is responsible for locomotion, which the upper body is not. Thank you. I hope you've learned something. Hope you enjoy